Welcome back to Second Chance Histories, where we explore the extraordinary moments that challenge our understanding of human intuition and reveal that sometimes the most remarkable abilities emerge in people who dedicate their lives to caring for others in their most vulnerable moments. Today's story takes us to the cardiac unit of St. Joseph's Medical Center in Phoenix, Arizona, where night nurse Rachel Murphy began experiencing something that would fundamentally change how the medical community thinks about prediction, prevention, and the mysterious ways that some healthcare workers seem to sense danger before it becomes visible to conventional medical monitoring. This is the story of the Prophet nurse, where one woman's inexplicable ability to predict medical emergencies hours before they occurred became a phenomenon that saved hundreds of lives and challenged everything doctors thought they knew about the limits of human perception in healthcare settings. Rachel Elizabeth Murphy had been working the night shift in the cardiac intensive care unit at St. Joseph's Medical Center for 12 years, a position that required extraordinary vigilance, quick decision-making, and the ability to recognize subtle changes in patients' conditions that could signal life-threatening emergencies. At 42, Rachel was everything her colleagues and supervisors valued in a cardiac nurse: experienced, intuitive, compassionate, and possessed of what seemed like supernatural timing when it came to appearing at patients' bedsides just when they needed her most. Rachel has always had this uncanny ability to sense when patients are going to have problems before our monitors detect anything wrong, observed Dr. Michael Rodriguez, the head of cardiology at St. Joseph's. She would show up in patients' rooms and start adjusting their care just minutes before alarms would start going off. Rachel's colleagues had noticed this pattern for years, but they attributed it to her experience and her careful attention to subtle clinical signs that less experienced nurses might miss. "We all thought Rachel was just incredibly observant and experienced," said Jennifer Martinez, the day shift supervisor who worked closely with Rachel during shift changes. "She seemed to notice tiny changes in patients' breathing, skin color, or behavior that indicated they were heading toward crisis. We assumed it was just exceptional clinical skill." But in early 2019, Rachel began experiencing something that went far beyond exceptional clinical observation. She started having vivid, detailed dreams about specific medical emergencies that would occur during her upcoming shifts, dreams that proved to be precisely accurate predictions of events that hadn't yet happened. The first dream that Rachel recognized as genuinely prophetic occurred on a Tuesday night in March 2019. Before leaving for work, Rachel had taken a brief nap and experienced an extraordinarily vivid dream about Mr. James Patterson, a 68-year-old patient who was recovering well from routine cardiac catheterization. In the dream, Rachel saw herself rushing to Mr. Patterson's room at exactly 2:47 a.m. to find him experiencing sudden cardiac arrest. She witnessed every detail of the emergency response: which medications were needed, how long the resuscitation would take, and even specific conversations between the medical team members during the crisis. The dream was so realistic that Rachel woke up feeling like she had actually lived through the emergency. But when she arrived at work that evening, Mr. Patterson was stable and showing no signs of distress. "I felt foolish," Rachel later recalled, "but the dream had been so vivid that I couldn't shake the feeling that something was going to happen to Mr. Patterson. I kept checking on him throughout the night, even though his monitors showed he was completely stable." At exactly 2:47 a.m., Rachel was walking past Mr. Patterson's room when she heard his cardiac monitor alarm. She rushed inside to find him in cardiac arrest, experiencing exactly the emergency she had dreamed about hours earlier. "Everything happened exactly as I had seen it in the dream," Rachel said. "The medications we needed, the length of time it took to restore his heartbeat, even the specific words that Dr. Rodriguez said when he arrived to help. It was all identical to what I had experienced while sleeping." Mr. Patterson survived the cardiac arrest and made a full recovery, but Rachel was left wondering if the dream had been an extraordinary coincidence or something more mysterious. Over the following weeks, Rachel continued to experience prophetic dreams with increasing frequency and accuracy. She would dream about specific patients experiencing specific medical emergencies at specific times, and these dreams would prove to be precise predictions of events that occurred during her subsequent shifts. She dreamed about Mrs. Elena Santos developing complications from her heart surgery 12 hours before the complications manifested. She witnessed in her sleep the exact emergency procedures that would be needed and was able to prepare accordingly when the crisis actually occurred. Rachel dreamed about young David Chin experiencing an allergic reaction to a new medication 6 hours before he was scheduled to receive it for the first time. Her dream showed her the specific signs of the reaction and the treatments that would be required, allowing her to be prepared with antidotes before the reaction began. Most remarkably, Rachel's dreams were proving to be not just accurate predictions, but detailed instruction manuals for handling emergencies that hadn't yet occurred. Rachel started coming to work with very specific preparations for emergencies that couldn't possibly be anticipated based on patients' current conditions, observed Dr. Patricia Williams, who worked frequently with Rachel during overnight shifts. She would have medications ready, equipment prepared, and backup staff alerted for crises that didn't develop until hours later. As Rachel's prophetic dreams continued to prove accurate, her colleagues began documenting the phenomenon systematically. Dr. Rodriguez started keeping detailed records of Rachel's predictions and the subsequent medical events. Over 6 months, Dr. Rodriguez documented 47 instances where Rachel had accurately predicted specific medical emergencies, timing, and required treatments with precision that exceeded statistical possibility. Rachel's accuracy rate was 100%, Dr. Rodriguez reported. Every dream she shared with us about upcoming medical emergencies proved to be completely accurate in terms of the patient involved, the type of emergency, the timing, and the treatment protocols that would be needed. The predictions covered a wide range of cardiac emergencies, heart attacks, arrhythmias, surgical complications, medication reactions, and device malfunctions. In each case, Rachel's dream provided detailed, medically accurate information about events that hadn't yet occurred. What made Rachel's dreams particularly remarkable was their clinical precision, Dr. Williams noted. She wasn't just dreaming that something bad would happen to a patient. She was receiving detailed medical information about specific conditions, exact timing, and precise treatment protocols. The practical impact of Rachel's prophetic abilities was extraordinary. Because she could predict medical emergencies hours in advance, she was able to prevent many crises entirely and respond to others with unprecedented speed and preparation. When Rachel dreamed about Mr. Robert Martinez developing a dangerous heart rhythm at 4:15 a.m., she was able to have the appropriate medications ready and the cardiac team on standby. The emergency was resolved within minutes instead of the typical longer response time. When she predicted that Mrs. Sarah Thompson would have complications during a scheduled procedure, Rachel was able to alert the surgical team to specific risks they should monitor, potentially preventing a fatal outcome. Most remarkably, Rachel's predictions allowed the medical team to prevent some emergencies entirely by making proactive adjustments to patients' care based on the information from her dreams. Rachel's ability to predict medical emergencies transformed our entire approach to cardiac care, Dr. Rodriguez explained. Instead of being purely reactive, waiting for problems to develop and then responding, we could be proactive, preventing crises before they fully developed. Word of Rachel's prophetic abilities spread throughout the medical community, attracting the attention of Dr. Sarah Chin, a researcher at Arizona State University who studied consciousness and precognitive phenomena in healthcare settings. Dr. Chin requested permission to conduct a formal study of Rachel's predictive dreams, hoping to understand whether this was a genuine precognitive ability or an extraordinary form of subconscious pattern recognition. Rachel's case represents one of the most well-documented examples of apparent precognition in a medical setting, Dr. Chen explained. We want to understand whether she's accessing information about future events through unknown mechanisms, or whether her subconscious mind is processing current patient data in ways that allow her to predict likely outcomes with unusual accuracy. The study involved monitoring Rachel's brain activity during sleep, documenting her dreams in detail, and comparing her predictions to actual medical events over a controlled period. Dr. Chen's research revealed several remarkable findings about Rachel's prophetic dreams and their relationship to actual medical events. Brain monitoring during Rachel's prophetic dreams showed unusual activity patterns unlike those typically associated with normal dreaming. Her brain displayed heightened activity in regions associated with pattern recognition, temporal processing, and sensory integration. Rachel's brain appears to be processing information during sleep in ways that allow her to extrapolate current patient data into accurate predictions of future medical events, Dr. Chen reported. Whether this represents genuine precognition or an extraordinary form of subconscious analysis, the results are medically valuable and scientifically fascinating. The study also revealed that Rachel's accuracy was highest when she had been caring for patients for several days and had extensive familiarity with their conditions and responses to treatment. Rachel's predictive ability seems to be enhanced by her deep knowledge of individual patients, Dr. Chen noted. The longer she had been caring for someone, the more accurate and detailed her prophetic dreams became. As Rachel's prophetic dreams continued, her abilities seemed to expand and become more sophisticated. She began having dreams not just about individual patients, but about unit-wide events and systems problems that could affect multiple patients simultaneously. Rachel dreamed about a power failure that would occur during a storm 3 days later, allowing the hospital to prepare backup systems in advance. She predicted equipment malfunctions hours before they occurred, enabling repairs that prevented patient care disruptions. Most remarkably, Rachel began having dreams about medical emergencies involving people who weren't yet patients at St. Joseph's, people who would be brought to the hospital by ambulance during her shift. Rachel would tell us to prepare for specific types of cardiac emergencies that would arrive by ambulance at specific times, Dr. Williams recalled. She would describe the patient's conditions, their treatment needs, and even details about their personal circumstances, all hours before they arrived at our hospital. Rachel's prophetic abilities raised complex ethical questions about how to use information obtained through unexplained means in medical decision-making. Hospital administrators and medical ethics specialists had to develop protocols for incorporating Rachel's predictions into patient care while maintaining appropriate medical standards and documentation. We faced the unusual situation of having medically valuable information that came from sources that couldn't be explained or replicated through conventional means, explained Dr. James Patterson, the hospital's chief medical officer. We had to find ways to use Rachel's insights responsibly while ensuring that all medical decisions were based on sound clinical judgment. The hospital developed a system where Rachel's predictions were treated as early warning indicators that prompted increased monitoring and preparation, but never replaced standard diagnostic procedures and medical protocols. The intensity and frequency of Rachel's prophetic dreams began to take a significant personal toll. She found herself sleeping restlessly, experiencing vivid medical emergencies in her dreams every night, and feeling emotionally exhausted by constantly witnessing patient crises in both her sleep and her waking hours. Rachel was essentially working 2 full-time jobs, observed her colleague Jennifer Martinez. She was caring for patients during her regular shifts and then experiencing additional patient emergencies in her dreams every night. The emotional and mental strain was enormous. Rachel also struggled with the weight of responsibility that came with her prophetic abilities. When she predicted serious emergencies, she felt responsible for ensuring that every possible preparation was made to save the patient's lives. "I couldn't ignore the dreams, even when I was exhausted," Rachel explained. "If I saw someone having a heart attack in my dream, I had to do everything possible to be ready when it actually happened." The knowledge felt like both a gift and a burden. Based on Rachel's experiences and the research findings, Dr. Chen and the medical team developed training programs aimed at helping other healthcare workers develop enhanced intuitive abilities for recognizing patient risks. While none of the trained participants developed prophetic dreams like Rachel's, many showed significant improvement in their ability to recognize subtle signs of impending medical emergencies. "We can't teach people to have prophetic dreams," Dr. Chen explained, "but we can train them to pay closer attention to the subtle cues that Rachel has learned to recognize: changes in breathing patterns, skin color, behavior, and other indicators that often precede medical crises." The training program, called Predictive Patient Assessment, was implemented in cardiac units at hospitals throughout Arizona and eventually adopted by medical schools as part of nursing education curricula. As news of Rachel's abilities spread throughout the medical community, other healthcare workers began reporting similar experiences with prophetic dreams and enhanced predictive abilities. Dr. Maria Santos at Denver General Hospital documented cases of nurses who had developed the ability to sense impending cardiac events hours before they occurred. Dr. Robert Chen at Seattle Medical Center reported on emergency room staff who demonstrated unusual accuracy in predicting which patients would develop complications. Rachel's case appears to represent an extreme example of abilities that may exist in less developed forms in many healthcare workers, Dr. Patterson observed. Her story has encouraged medical professionals to pay more attention to their intuitive responses and to take their predictive concerns seriously. Research into healthcare intuition and predictive abilities became a recognized field of study, with Rachel's case serving as the foundational example of how these abilities could save lives when properly recognized and utilized. St. Joseph's Medical Center became known throughout the region for its exceptional patient outcomes in cardiac care, with survival rates and complication prevention that exceeded national averages. "Our ability to predict and prevent cardiac emergencies has transformed our patient care," Dr. Rodriguez explained. Rachel's prophetic abilities, combined with the enhanced awareness she's taught all of our staff, has created an environment where we can prevent many crises that would have been fatal in the past. The hospital established the Rachel Murphy Center for Predictive Cardiac Care, dedicated to researching and developing methods for predicting and preventing cardiac emergencies before they fully develop. 5 years after Rachel's prophetic dreams began, she continues to work at St. Joseph's Medical Center, where she has helped prevent or manage over 300 cardiac emergencies with unprecedented preparation and success rates. Her predictive accuracy remains consistently high, though she has learned to manage the personal toll through counseling, stress reduction techniques, and scheduling modifications that allow for adequate rest between intensive predictive periods. Rachel's abilities remain as mysterious as they were when they first appeared, Dr. Chen admits. "We understand more about how they work and how to use them effectively, but the fundamental question of how she accesses information about future medical events remains unanswered." Recent cases continue to demonstrate the life-saving value of Rachel's prophetic dreams, with patients like Mrs. Helen Foster crediting Rachel's predictions with saving her life during a cardiac emergency that was anticipated and prepared for hours in advance. The medical community's understanding of Rachel's abilities has evolved from initial skepticism to serious scientific investigation and practical application. Rachel's case has opened an entirely new field of medical research into predictive healthcare abilities, Dr. Chen concluded. Whether her dreams represent genuine precognition, extraordinary pattern recognition, or some combination of both, the practical benefits for patient care are undeniable. Research inspired by Rachel's case has led to advances in understanding healthcare intuition, pattern recognition in medical settings, and the development of training programs that help medical professionals enhance their predictive abilities. The principles learned from studying Rachel's prophetic abilities have been applied to other areas of healthcare, with programs developed for emergency medicine, surgical prediction, and medication reaction prevention. Rachel's legacy extends far beyond the individual lives she saved, reflected Dr. Patterson. She's shown us that human perception in healthcare settings may be far more sophisticated than we previously understood, and that paying attention to these enhanced abilities can improve patient outcomes across the entire healthcare system. Today, Rachel Murphy continues her work as a cardiac nurse at St. Joseph's Medical Center, where she remains the most requested nurse among both patients and physicians who have experienced the life-saving benefits of her predictive abilities. Her story has transformed how the medical community thinks about intuition, prediction, and the extraordinary capabilities that can emerge in healthcare workers who dedicate themselves completely to patient care. I still don't fully understand how the prophetic dreams work, Rachel reflects. What I know is that they've allowed me to save lives that would have been lost if we had waited for traditional warning signs to appear. If this ability is a gift, then I'm grateful to be able to use it to help people. The prophet nurse reminds us that human consciousness may be far more capable of accessing information and predicting outcomes than conventional science has yet recognized. Her story proves that some healthcare workers develop abilities that transcend normal medical training, creating opportunities to save lives through preparation and prevention rather than reaction and treatment. Rachel represents the potential that exists within healthcare workers who combine exceptional skill, deep caring, and mysterious abilities that we're only beginning to understand, concludes Dr. Rodriguez. She's shown us that the future of medicine may involve not just treating diseases after they develop, but preventing them by recognizing their approach hours or even days in advance. In a world where medicine often focuses on reactive treatment, Rachel Murphy's prophetic abilities offer hope that the future of healthcare may be increasingly predictive and preventive, guided by healthcare workers whose dedication to patient care has unlocked extraordinary perceptual abilities that can save lives before emergencies fully develop. The prophet nurse continues to dream of medical emergencies yet to come, and patients continue to live because someone was watching over their future with the vigilance that only comes from completely dedicating one's life to the welfare of others.